The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how to save your teeth. If you've been told that you have periodontal disease, bleeding gums, bad breath, puffy swollen gums, or no symptoms at all, but haven't seen a dentist in a long time, you have to hear what my first guest has to say. His name is Dr. Peter Warshawsky. Dr. Warshawsky, welcome to the program.
Hey, thank you so much for having me, Randy. Thank you.
I've been trying to get you on the show for about 7-8 years.
Correct.
That's a fact. Saw you in the gym, and you're in good shape, by the way. You look like you still lift weights.
I enjoy working
right?
out, yep.
Okay, and so we got you on the show. Now, today's topic, you're a periodontist. Tell us about the kind of patients that you see. What kind of a practice is it?
We see all kinds of patients, Randy. We see young patients, old patients, patients that basically are concerned about their teeth. Patients that may have been told they're going to lose their teeth, patients that notice their teeth are loose, patients that have gingival recession or gum recession, patients that have sensitive teeth. So we see all sorts of people.
And you say that you want to become a periodontist because you wanted to save teeth.
Exactly.
Really?
Yeah, no, it's a simple goal.
That's an interesting thought, by the way, that's why somebody would, I mean, you were motivated by doing that.
If you really think about it, who doesn't want their teeth?
Yeah, okay.
Randy, if I said to you you were going to lose your front teeth, how would you feel about that?
Well, terrible.
Just terrible? Or
well, no,
would it
I'd
be
kill
devastating?
myself. No, of course, I wouldn't like it. Right, I wouldn't like it.
It would be devastating.
Yeah.
And what is so cool is as a periodontist, we have special techniques, special ways to help you save your teeth. And that is so rewarding because I think most people really value having their teeth.
Okay, now before we get into these photos, let's talk a little bit about, okay, so if somebody's watching this, and you told me it's not always these symptoms, but bleeding gums, puffy, inflamed gums.
Sometimes it's not even that, Randy.
Teeth.
It is so subtle.
But go to your dentist, you say.
You need to go to the dentist. You need to have an evaluation. Do you have periodontal disease? 75% of the population has periodontal disease.
Is that right?
And I would say 50% of that 75% have no idea that this is going on.
You say, okay, so the teeth can be white on top. Because
Exactly.
I told you this. I said, frankly, my teeth are white. I mean, they look white teeth,
You have
right?
beautiful looking teeth.
Okay, but I don't go regularly at all, and nobody's ever told me about pockets. I've never asked anybody to check for these pockets, you say. So let's define what a pocket is, how
Simple.
it's looked
Hey, Randy,
at.
what a pocket is basically the gap between your tooth and your gum.
Okay.
That gap should be pretty small, 2 to 3 millimeters. If that gap deepens, bacteria gets into that space. The bacteria remains there, sometimes for 20, 30, 40 years. That bacteria causes changes in your body. Those changes are a way for your body to rid itself of infection by destroying the gum and bone that hold your teeth in place.
To reject the tooth.
Correct. It's your immune system saying...
Interesting.
It is fascinating. It's your immune system, Randy, saying, we have invaders, we have bacteria crawling underneath our gum line. Your body doesn't like them being there, so your body sends a bunch of chemicals to your gums to fight this problem.
Which is killing the tooth.
Well, not so much killing the tooth, killing and destroying the gum and bone that hold the tooth in place with the hope that the tooth will fall out. So your tooth is being rejected by your body as a defense mechanism.
I've heard a lot of speeches on periodontitis or periodontal disease over the years, and you were very simple on the phone. You said, Rand, it's very simple. They come in, we remove the cause, and that's it.
Randy, exactly. I
mean,
love the way you phrased that. And
you phrased it that way. That was your
thank
words.
you. If you had a splinter in your finger, what would you do?
You get rid of it.
Same exact thing. Periodontal disease is caused by bacteria underneath the gum line, is the initiating factor. There are certain risk factors such as smoking, diabetes, medications that can complicate things, but the basic underlying fundamental cause is bacteria. Randy, there are probably 700 different bacteria that live in your mouth, 400 of which get underneath your gum line. Is that an amazing number to you?
Okay.
Did you know that?
I didn't know that.
Does that bother you?
Actually, it does not bother me that much because my teeth feel pretty good. But I can appreciate the fact that.
Well, I'm going to show you some pictures, Randy. The first one I want to show you is this fella.
Okay.
Or these are two different people, actually.
All right.
Both these people thought their teeth felt fine. They really never, ever had any pain. Then one day they were looking at their teeth and noticed they were loose, or they noticed the gums had receded, or they couldn't eat what they wanted.
So receding gums, and I'm sorry to interrupt you. I know your friends, they said Randy interrupts people all the time, and I'm not trying to.
I was warned about that, Randy.
But isn't just, I mean, if you brush too hard, Couldn't it be?
Sort of a wives' tale, and that's just one factor. But these are people that really didn't brush their gums or take care of their teeth properly. There's bacteria underneath the gum line that's causing your body to say, hey, we got problems. Your body needs to get rid of this tooth. It releases chemicals to destroy the gum and bone with the hopes that that tooth will fall out in your next beef jerky.
Okay, so, but in this particular case, if you catch that, because that looks fairly early, they go into you.
Absolutely not, Randy. This is quite advanced. In fact, this fellow ended up losing this front tooth. What I'm saying to you is, well before it got to this degree, hopefully you've gone to your dentist to have a periodontal examination, and they've noticed that, hey, this tooth looks like it's at risk to get like this. Get it taken care of well before it gets to this
Go to the
extent.
periodontist, have them remove it.
Or even have
her remove it.
No. We want to save your teeth. We want to get you before it gets to this point.
Remove that,
the bacteria.
That's underneath the gum line.
The cause, exactly. The other picture on the right is one where this person ended up losing many of their teeth.
On the right side. Okay.
Correct. And they ended up losing many of their teeth. Again, the bacteria was leading to destruction of the gum and bone that hold their teeth. I want people to realize it doesn't have to get to this point.
Now, in my mind, by the way, maybe I'm naive because I have my teeth, I'm surprised that people let it get to this point. Is it because it doesn't show visually, and so they hide it?
That is part of it.
What is it?
Part of it is they're unaware that there's a problem going on. It's sort of like a person with high blood pressure. If they don't have a checkup with their physician to know they have high blood pressure, they'll never know they have high blood pressure, and they can end up having a heart attack.
Okay.
Same thing with teeth. If you don't have an examination with your dentist or a periodontist, you could be totally unaware.
And these people could be sedated. I mean, for the people that are really afraid, they could have IV sedation.
We do that
or some
all
type
the time,
okay.
And it makes it such an easy experience. In fact, there are patients that are so anxious they won't even have a regular cleaning of their teeth because they don't like being at the dentist.
I don't like it. I mean, the gag part of it for me is terrible. That's why it keeps me away.
Right.
Okay, I love this next photo. I'm looking at it right there. That's what's going on underneath? That's what a tooth looks like?
Exactly.
Is that an actual picture?
This is a 36-year-old female that ended up losing her teeth. As you see on the right, the tops of the teeth, the shiny white part.
They look good. They look good.
Exactly. But underneath the gum line was a accumulation of bacteria. That's the dark stuff you see on the root surfaces.
Yeah.
The dark stuff is a coral matrix of bacteria into which other bacteria grow and live.
But at this point, because obviously they're out of the mouth.
Correct.
It's too late.
Way, way too late.
Okay.
My message is simple. Don't wait till it gets
So
to this
they were
point.
told by their dentist probably, you have these pockets, you have
Exactly.
periodontal disease. I mean, how does a dentist phrase it, by the way, when they catch this? You have pockets, you have periodontal disease, what do they say?
All of the above, Randy. And a lot of patients, since they're unaware, they don't feel anything going on, they don't act upon it. But through this show, hopefully I'm increasing awareness that bacteria does live underneath your gum line. It stays there for 10, 20, 30, 40 years, and if not removed, will lead to the loss of your teeth. You think that previous examples were bad. Let me show you these pictures, Randy. Here are random patients from our practice within the last month. All these people never had any signs or symptoms. They were unaware.
Are these indigent people or poor people?
Absolutely not. These people all started out with gingivitis or maybe even health. Then they got busy with their careers, their professions, maybe didn't go to the dentist that regularly.
Did they tell you that, by the way? Because you're saying this. I mean, is that what they say? Hey, I was so busy, I didn't.
Absolutely. Life gets in the way of some things.
But they have an infection the whole time. They're working, they're busy, they have an infection.
It's a very low-grade infection.
They don't know about
it's not super obvious that it's going on. You know, you do hear occasionally.
It's insidious. I mean, it gets worse and worse.
Very gradually gets worse. You hear some patients say, you know, I was feeling sort of lethargic. I couldn't control my diabetes because something was wrong, but I wasn't sure what it was. Actually, science and research is realizing that the infection in the mouth creates changes in your body that affects your heart, your respiratory.
This bacteria leaks into your bloodstream somehow?
Absolutely.
Okay, back to these folks for the sake of time. Okay, so these folks, did all of the people in that picture lose their teeth? Or were you able to save them?
Ended up, a lot of these people lost a lot of teeth. But my goal is to educate people to do not wait till it gets to this degree. Early intervention will save you thousands of dollars.
And
save
pretty much
your
no pain. I mean, you
Absolutely.
go in.
Absolutely. And you know, with the sedations that we do, we can make it the easiest experience.
So see your periodontist. Ask him how many pockets. Or
if you value your teeth, if you care about your teeth, Randy, you should know the periodontal condition.
All right. Let's go to the next.
Yeah, this is an amazing picture, Randy, and this sort of summarizes my whole message. This picture here shows the following. The upper arrow shows or points to the top of the tooth.
Looks shiny and healthy.
Exactly. Okay. But underneath, the bottom arrow points to basically dark charcoal-looking material, and that's basically tartar or calculus. This is bacteria that's calcified over many years, and in this, it's sort of like a coral reef, and in this coral reef is millions of bacteria. And as I mentioned previously, this bacteria causes your body to say, we have invaders.
So reject the tooth.
Get the tooth out of my mouth so I don't die from the bacteria.
Well, obviously, if one tooth, chances are this is kind of spread throughout the gum line. Is that right?
It can. The problems can be sometimes
so
localized.
So the snowball of losing the teeth all starts here.
Absolutely.
Right? Okay, so the next photo.
Next photo shows, again, the ravages of periodontal disease. It can affect the way people eat, chew, speak. Self-confidence can be greatly declined. People will speak.
But these are all people, like these pictures. I mean, these are terrible
pictures. I see
pictures.
this 7 or 8 times a day.
Catch it early. You don't have to do it. But in these cases, they have to be removed. You put dental implants and they have to get...
Correct. But again, my message is, let's not do the dental implants. Let's get you before you need that.
Okay.
Look at that top right picture. The top of the teeth were pretty clean, but underneath the gum line, where the patient couldn't see it.
I've never seen that before.
It's amazing. And that's why I'm sharing it with you.
It's not touched up a little bit?
I don't know how to do that.
Warshawsky.
I don't know how to do that kind of stuff.
All right, okay. So the next photo, that's early?
Exactly, exactly. The next example
shows... Can they look
at
home and do this?
You know, some people can, some people can't. I recommend seeing your dentist, seeing your dental hygienist, have them check.
Pink areas at the...
It's very, very subtle, and that's gingivitis. Slight inflammation of the gums is what gingivitis is. The disease is not progressed into the bone that holds your teeth in place, so it's at the gum line. Best time to treat and correct this problem if you want to save your teeth. If you don't correct this gingivitis and you're susceptible to periodontal disease, this can then spread into the bone and cause loss of bone. And that's what we see here, where the person's lost 3/4 of the bone that holds the teeth in place. The tooth is now loose, and they're going to end up losing this tooth if something isn't done soon.
Okay, now that tooth right there, is that one of yours, or so? It's like almost like clip art for bad mouths. That was one of your patients.
This, you know, like I said, we see this every day, Randy, and we're, you know, used to it. But this tells a story, and it tells the story of periodontal disease. You know, when I see this, I think to myself, how did this happen? And how did it happen is this. The patient was probably, this person was 68 years old at the time of this picture. When they were 20 years old, they probably had gingivitis, didn't do anything about it because they were too busy.
And a lot of these people are very successful people.
Absolutely. I mean,
okay.
I see tons of lawyers, accountants.
When I say that, I shouldn't say successful, but these are people with the money that could have done something, I should say.
Absolutely.
Okay.
But they either were too busy or didn't know this was going on or didn't believe it was going on or didn't want to believe it was going on.
Is it the kind of thing where, because, you know, my teeth aren't loose, that one day all of a sudden you realize in certain cases your teeth are loose, or the gums all of a sudden are going up?
Yeah, it's a gradual deterioration.
Just kind of happens?
Yeah, it's very gradual.
So with this person, again, you take that out, in their case, dentures or dental implants?
Yeah, that's what happens in this scenario, but I'm using this example, Randy, as sort of a learning experience. How did this person get like this? I'm a very inquisitive person by nature, and I wonder, how did they end up like this? And this person at one time had teeth, right?
Yeah.
People aren't born like this, so they had teeth. And maybe they were healthy when they were 13, 14.
It's very tough. Isn't it tough? I mean, on my show, we've had heart surgeons. Isn't it tough, though, to get people to prevent it? They like to wait until...
Correct, and that's why I'm here to educate people about periodontal disease. But if we break it down to the basics, and the basics being this, do you want your teeth?
You want your teeth.
And most people do. Rarely do I hear someone say, I don't care about my teeth. And if you want your teeth, know the periodontal status, because the leading cause of tooth loss is periodontal disease, and that's how this person lost all their teeth.
It's an easy fix. Remove the disease.
Remove the cause.
Okay.
It's like if you had a splinter in your finger again. If you had a splinter in your finger, what would you do?
Take it out.
Exactly.
Okay, we're going to take a quick break. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Hot topic, how to save your teeth. We haven't discussed this on the show before. With us, we have a board-certified periodontist, probably the desert's favorite periodontist, Dr. Warshawsky.
Thank you. A couple more examples here, Randy.
And by the way, that's what people say about you. Everybody seems to like you. I was talking to a developer in town, and he says, oh, yeah, I know him.
Well, my personality trait is I'm a pleaser.
But you like this stuff, too.
Oh, absolutely. I can't explain it, but I have a passion for it. I'm the type of guy, I'm very visual. I like seeing before and afters, and to be able to see the results, that's what I get a kick out of.
Saving teeth so they can eat and chew
but
and socialize.
A big message, and mission I have is to prevent cases like this one, Randy, where the gums have receded. The teeth are very sensitive. They can't eat ice cream. They can't drink, beverages.
Is that the first sign? That's not just a cavity. That could be...
Well, it's not necessarily the first sign. It can be a sign where the roots are real sensitive. And again, at that point, this deterioration is beyond a predictable repair. So I want people to come in before it gets to this point so we can fix it easily and comfortably and help save your teeth and allow you to enjoy your ice cream, enjoy your beverages, and not have to worry about your teeth.
Okay, tell me this real fast, and I try not to give any kind of personal stories on the show, but as I almost feel frustrated as I'm hearing this. I go to a local dentist. I've had one cavity in my life, okay, and I wanted to get a metal filling removed. He's a holistic dentist, removes my metal filling. He says, by the way, you have a little bit of periodontal disease. And that was it. And I said, oh, really? He goes, yeah. That was it. That's all we talked about. And the rest was, okay, see you later, hey, Randy, blah, blah, blah.
Well, that's why I'm here today,
Randy. But don't you think he should have shook me up and said, hey?
Well, I'd like him to shake you up. And that's part of my message here today, because some patients are very proactive. They're the types that are going to say, hey, what's periodontal disease? What's going to happen to me? What should I do about it?
I didn't even think much about it, by the way.
Other people are reactive. They're going to wait for something to happen. And that's what makes periodontal disease so damaging, is being reactive, just waiting. And if you wait too long, the teeth are too loose to do anything about it.
Yeah, I'm going to get this checked.
So look at these. Look at these, Randy. And so what we see here is another example where the gum is deteriorated. They're about to lose these teeth. I want people coming in when they're like this. Look at the picture on your left there, Randy.
That's a before and after I'm looking at.
It is a before and after. And what you see on your left is where the gums have receded 3 to 4 millimeters. The dentist noticed, and they actually shook their patient and said to them, hey, do you want your teeth? The patient said, yes, I do. And so what we can do is a very simple procedure to regrow, regenerate the gum through the use of growth factors.
So the gum just goes right back up?
Basically, yes. Let me show you one more example, if I could, Randy. This is a dramatic example. This is a 26-year-old female that was on the verge of losing her lower front tooth. She was totally unaware that this was going on. And you see
the dentist caught that.
Exactly. The dentist noticed that the gum was receding. The dentist noticed where the yellow arrow was pointing is bacteria pushing the gum away, sent the patient to our office. Quickly, in less than a half hour, we were able to regrow the gum, and voila, we've saved the tooth. And that is so awesome.
Let me understand, with that before picture, underneath there is a bunch of
goop.
Like
it's
bacteria.
Like mold growing underneath your carpet. It's like termites in the framework of your house, and you have no idea there are termites there unless you have someone come out and check it out.
So you remove that, use a little of your science to rebuild the gum.
And save the tooth. And that is my message.
So get more people in like that. So if they're watching this, I mean, they could pull their gums down and see what's going on.
They can. And if you have good eyes, you might be able to detect this.
And so I'm clear, they could go to their general dentist, get this checkup done, ask about pockets. They could go directly to you either way.
Absolutely.
Okay.
And we have great dentists in the Coachella Valley. We work with almost all of them, and we've worked with them and educated them about what we can do as periodontists, and we have great relationships with these dentists, and we would love to help you out with our mission of helping you save your teeth. Take a look at this one. This is a 42-year-old woman. Again, her dentist noticed that the gum was receding.
That seems so little, though.
Right.
Isn't that just
the less involved it is, the easier it is to fix. And so this is very subtle again, but unbelievably dramatic. And I'm excited to share this with you.
Now, if I were to diagnose that, I would think it's just from brushing too hard.
Far and away,
Not true.
Nothing.
Interesting.
Because actually the yellow arrow points to the bacteria that was underneath the gum line that the gum was pulling away from. So actually this person had bacteria underneath the gum line. The gum said, we don't like this bacteria being here. We're going to go away from it. So the gums start receding. So the dentist, unbelievable guy, notices this, says to the patient, hey, do you want your tooth? Of course the patient wants their tooth. Comes to our office, we remove the bacteria, regrow the gum.
This is interesting.
It's awesome.
Going into this, I thought this might be boring. You know,
and a lot of people would think that. Yeah,
no, but
exactly.
This is interesting because this happens to just about everybody.
75% of the population has some form of periodontal disease. And it is a shame how many people end up losing their teeth that could have been saved if it had been taken care of in a timely manner. And that is my message.
Okay, we're almost out of time, but some of the good stuff is coming up. Some of the cosmetic procedures you do to make those gums look good.
Exactly.
What's that?
What we're showing here is some of the things that we do in working with your dentist to make things look as beautiful as they possibly can. On your left is an example of a patient that had some old crowns placed. They were displeased with the appearance of the crowns. They didn't like the way the gums looked. The gums were a little bit too excessive in the amount of gum tissue present. The teeth were of uneven heights.
Gummy smile.
Exactly. So this patient's dentist sent the patient to us to recontour, modify the gums to allow for a more aesthetically pleasing result.
The cosmetic dentist in this town, by the way, or in Palm Desert, Rancho Mirage, the Coachella Valley, I've talked to them. They say, Randy, to complete, you can't just do these veneers. You've got to look at the gums, and we sent them to you. I mentioned that.
Exactly. So here's another example, and this is a similar type of situation where on your left you see a situation where, what do the teeth look like to you, Randy?
Flat.
Flat. And a lot of people think...
Like old, too.
Exactly.
They're white, but,
So what we see here is, as you said, on the left side, the teeth look worn, they look old. So through recontouring the gum tissue, which is what this patient's dentist wanted us to do, we recontour the teeth, make them a little bit taller, makes for a more youthful.
I'm going to interrupt again. Is this a tooth lengthening procedure?
Exactly. The technical term would be crown lengthening.
Oh, crown lengthening.
Exactly.
I almost had it. Okay. Then I'm not kidding. We're just about out of time, so we'll have to sail through these. What are we looking at?
Yeah, we have so many examples. This shows a little closer view of the previous case where what we see is on your left side, the height and width of the teeth is about equal, 1-to-1.
This is interesting. Okay, because I always hear about dimensions.
Yeah, and we're all about the dimensions of the teeth. A longer tooth, a tooth that's taller and slimmer, is going to look more youthful, and that's the difference.
So in that after, you moved up the gum
prior to this patient's dentist performing
the veneers.
Exactly, and the patient is absolutely thrilled, can't stop smiling.
What about that over there?
This is a case that Dr. Jacobson in our office treated, and what it shows is a similar situation where Dr. Jacobson did crown lengthening or recontoured the gums in a very delicate, gentle manner prior to this patient's dentist giving her the new veneers.
A lot of gummy smiles out there. Ever since I learned about gummy smiles from some of the dentists that I've interviewed, I see them all over the place.
Exactly.
And they don't know what can be done.
Exactly.
Talk to your periodontist, fix it, combine with the cosmetic dentist.
You can enhance the smile so much. The next case is a pretty dramatic example where we see a before and after. Now this is an interesting story.
That's a real picture of one of your patients?
Yeah, exactly. One of our patients, she was reluctant to ever have dental treatment done because she didn't know what could be done to help her out.
And I'm trying not to interrupt, but that particular before picture, that's got to be the worst you've ever seen as well.
Well, we've seen a number of cases very similar to this.
Okay.
We do see patients like this. And what's interesting about this gal is she goes on 6 or 7 cruises a year, travels the world, but she can't enjoy these great trips she goes on because she's embarrassed to smile. She looks unhappy because she doesn't want to show her mouth. She can't enjoy the food on her cruises.
Yeah, and they're free on the cruise, and she can't even eat with those teeth.
Exactly.
Why? It is because they're loose, they're soft, they're sore?
All of the above, Randy.
Sensitive?
In fact, she can wiggle these teeth and probably pull them out with her own fingers.
Now, something you said to me, is it that on the consult she sneezed?
And the tooth did come out and she reinserted it.
Really? And it was her own tooth?
It was her own tooth.
So she was used to...
And again, this was her immune system trying to reject the tooth because of the bacteria.
Interesting, okay.
But let's turn it into the positive, which is what I am all about, being positive. And what we're able to do for this lovely lady is remove the infection from her mouth by removing the teeth, and then we actually provided dental implants so that her replacement teeth would fit very rigidly in place and she can eat whatever she wants in total comfort. And above that, she's healthy. We've eliminated bacteria from her system, and
so now she's smiling.
She's smiling from ear to ear.
Is it true now, and I guess this could be a big topic, smokers, they're at really high risk for this, for periodontal disease?
Correct, there are a number of risk factors that come into play.
And they have no symptoms, oftentimes.
Absolutely.
Okay.
Smokers, typically their gums won't bleed. Typically their gums aren't very swollen because the smoking reduces the inflammatory reaction to the bacteria, and as a result, the symptoms are quite masked.
And then just slowly, all of a sudden, their teeth start getting loose.
Exactly. And there are other risk factors such as genetics. About 30% of the population has an early predisposition for periodontal disease because of their parents. So you can blame your parents, Randy, if you end up losing your teeth because you don't know what your pocket depths are.
So you think I need to get it done?
If you value your teeth, Randy, I
never thought of looking at my pockets. I mean, I only look at the top of my teeth. And
exactly, that's the way most people are.
Clean.
And that's why I'm here, because I think we can make a huge difference for the population in terms of educating them what can be done to save their teeth.
Now, I guess a lot of people don't care about saving their teeth, but until they're gone.
I don't think a lot of individuals think that deeply about it. I think
But when they're gone, it's like anything else. You miss it when they're gone.
Exactly, they want it back. But if you phrase it like this, Randy, do you value your teeth? Do you want your teeth?
Yes.
Everybody is going to say yes.
Okay.
Rarely do I have a patient that says, I don't really care about my teeth. So most patients do want their teeth. Okay. And if you want your teeth, know what's underneath the gum line, know their periodontal condition. If it gets taken care of in an early time, you will not lose your teeth.
Well, thank you for coming on the show. Very good. Very interesting.
Thank you so much.
Hot topic. Hot topic. So they can go to your website, find out more.
Yes.
And they can either talk to their general dentist or call you directly.
Absolutely.
Okay. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you can visit us online at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.